So welcome everyone. This is the ASQ Innovation Division partnering with the ASQ Healthcare Division to bring you building a culture of excellence in healthcare and education. You are in for such a treat because we have a moderated panel discussion tonight, which is really going to be talking about the rapid evolution of healthcare and education landscapes and how they foster a culture of innovation, continuous improvement, and excellence. Our wonderful facilitator and our speakers are here with you tonight. So let's give a big round of applause for just their phenomenal background. We have tonight with us Dr. Boudreau, Dr. Lemberger, and Ms. Mulvey. And we welcome you to ask questions as we go through. Again, this will be a moderated panel. You can put all of your questions in the chat. And so we really want to highlight the panel and our facilitators' wonderful background, not only in innovation, leadership, and design thinking, but inspiring strategic transformations and being key to bringing healthcare innovation to major organizations and being recognized as a innovation fellow, etc. You have a rich, deep, broad spectrum of views from innovation and excellence across healthcare and health economics and education. So without further ado, let's welcome to our digital stage tonight our phenomenal moderator and panelists.
Thank you very much. Good afternoon, everyone, and welcome from all over the world. It's an honor for us to be here today. My name is Marcela Campoli, and I serve as the director of the American Nurses Enterprise Institute for Nursing Research and Quality Management. For me, this is truly an honor to be presenting alongside my colleagues from the American Nurses Enterprise. As a long-standing member of the American Society of Quality, I have had the opportunity to engage in many different capacities, but this is my first time presenting, and what an honor to be presenting with you, Ori, Olivia, Tanya. Today we are presenting and discussing this fantastic journey in quality and innovation for the American Nurses Enterprise. That's named Innovation in Action, Building a Culture of Excellence in Healthcare and Education. Before we start with the presentation and we let the stars shine, we need to first acknowledge and appreciate the Innovation Division that invited us tonight to this presentation. Then we need to also disclaim and say that there are multiple other collaboration and collaborators that supported us in this journey. So we appreciate those and we recognize their participation in this work. While American Nurses Credentialing Center is ISO 9001-2015 certified, we need to clarify and disclaim that we are not actually certified in the innovation certification for ISO. That's the ISO 56000. I believe many of you may know about the ISO 56000. However, I need to tell you something, that being an ISO certified agency, being a unique and the only one certifying agency and credentialing agency in the world, being certified with ISO, that ISO journey helped us understand how the ISO 56000 was so absolutely applicable to every single step of we were taking in this journey forward. So we appreciate that. We appreciate the association with processes and procedures, and also the capacity to have the standards guiding us along the way. Now I will leave you to Olivia and Tanya that will present this specific journey.
Excellent. Well, thank you for that wonderful introduction. Marcella, my name is Tanya Mulvey, and I am also with the Institute for Nursing Research and Quality Management. So Marcella and I work together on the same team, and we were really excited to be collaborating with our colleagues, Oriana and Olivia, in the innovation department. So that's one of the key themes of what we want to present, is this collaboration and coming together of our two teams with expertise in quality and expertise in innovation, and how this whole project evolved for us to work to advance our organization in both of these areas. So here we're just sharing what the key learning objectives are for today's webinar that we hope that you take away from today's conversation. We want to try to make this very engaging, and we'll be posting some questions in the chat as we go along. So we do encourage you to participate, post any comments, lessons learned. One of the things I think is wonderful about webinars is a great opportunity for us to all learn from each other. So I hope that today I can be learning from you as well as you learning from us. It's just a wonderful opportunity. So moving on to the first area on aligning innovation with this standard that Marcella was just introducing earlier, we feel it's really helpful and important to seek out frameworks, standards, best practices that can help organizations develop the structure and the support needed to build a culture of innovation and quality. So this is one key example of a resource that could be really helpful in guiding such a journey for organizations, any type of organizations. I think it's really applicable across, well, we're a nursing organization that has also a foundation and a credentialing center, but I think it's really applicable very broadly. So what is ISO 56000? It's really a global framework for innovation management systems. And this matters because this supports structured innovation in complex environments, can help to enhance outcomes in healthcare and education, and empower teams to be able to innovate and adapt. So some of those key principles around the innovation management standard are having that value realization. So ensuring that innovation is driving measurable impact, having support of the leadership and developing a culture that can foster creative and empowering environments, having strategic alignment that links innovation and quality together with the mission and values, having risk-based thinking and adaptability, being able to embrace uncertainty with resilience, and having evidence-based decision-making, using data to guide innovation and quality initiatives and decisions. And finally, having a key stakeholder focus, really ensuring that we're engaging our customers, our users, and our communities to ensure that our vision and mission is aligned with those who are relying on us to provide products and services. And I think we do want to pause here and have a question in the chat. Let's see. Are we going to have the questions posted in the chat? I can read a question out loud if that's helpful. Let me see. So, well, the first question that we wanted to pose, and we would invite you to share, please, in the chat, is we're curious what certifications your organizations may have, and how do they align with this standard in these principles that I've just kind of explained. So if your organization has a standard that's this standard or a similar standard, please go ahead and do share that in the chat. We're interested to see that. So how does this standard apply to innovation and culture quality at the American Nurses Enterprise, or the ANE, as we like to call it? Well, with the ANCC, one of our entities of the organization having that certification in ISO 9001:2015 for quality management, we do have a very strong focus on quality in our organization. In embarking on this collaboration with our innovation team, we have been working to identify similarities and synergies across innovation and quality that can be leveraged to promote and grow these practices across the organization. And you'll see that'll be a key theme that we're talking about in this presentation, and the work that we've done is really how aligned those two concepts are and how important it is to work on promoting those together. And then measuring innovation together with common quality metrics like customer satisfaction can help to provide new information upon which database decisions can be made. Then through leadership support and strategic alignment of goals, organizations can create an environment that helps to empower others to ideate and seek continuous improvement to move the organization forward. And then finally, having that risk-based approach, conducting SWOT analyses, environmental scans, key components of quality management that can help organizations prepare for the future trends, the fast pace of changes in technology, and incorporating innovation strategies into these activities will help to be able to open doors to new ways of doing work that could improve efficiency and effectiveness and propel us forward into the future. So do we want to pause and see what we have in the chat? Let's see.
Yes, so I think ISO, oh, I'm sorry.
No, go ahead.
I was saying ISO 9001 seems to be one of your top rated ones.
Oh, wonderful. Well, and even if, organizations don't have certain certifications, we also wanted people to share how has innovation and quality in your organization helped you to meet objectives, meet your goals. So if you have any experiences with that in your organization, we welcome you to share that in the chat as well. And I think we can move on to the next slide then.
Wonderful. Thank you, Tanya. Hi, everyone. My name is Olivia Lumberger. I am the innovation scientist at the American Nurses Enterprise. So happy to be here with you all and share some of the work that we're doing that we hope can provide some takeaways of how you can take some of these learnings and apply them even tomorrow, right? As you're all heading back into your various health work environments. But when we're talking about leveraging data and analytics for decision making, we wanted to talk about the purpose of why we decided to come together. So in 2024, last year, our departments, the Innovation Department and the Institute for Nursing Research and Quality, we came together to really collaborate on an initiative to promote and foster an organizational culture of innovation and quality. And we did this for several reasons. One of the reasons is that this initiative directly supports one of our strategic plan goals of enabling operational excellence with an objective to deliver data-driven and customer-focused excellence through enhanced and agile technology and innovation. And I think that that could be a goal for so many different organizations across the industries, really, again, enabling operational excellence and delivering data-driven and customer-focused excellence. So maybe just to take a moment and reflect on how that may apply to you in your daily work. We really wanted to understand the perceptions, the knowledge, and behaviors related to innovation and quality practices. So to do that, we thought, how about instead of approaching innovation and quality as kind of these separate entities, kind of these disparate factors, what would happen if we examined the potential synergies of innovation and quality to really, again, try and create and foster that culture of innovation and quality. So moving from that disparate thinking to more that synergistic approach. So we designed a survey for which a new organizational innovation and quality assessment was really developed, and it was to support data-driven decisions. And this goal was really, again, to measure the effectiveness of interventions designed to promote a culture where people are thriving related to innovation and quality. And we feel like the study that we endeavored on is significant because there is limited research in how the synergistic components of quality and innovation impact work environments. So we're really excited to do this because nursing associations really play a crucial role in addressing healthcare challenges, improving access to quality healthcare, and promoting the advancement of nursing through research and evidence-based practices. Nurses and nursing allies, right? So our whole healthcare ecosystem are really co-collaborators in this space of high-performing healthcare cultures, and we are dedicated to exploring those concepts. And in doing that, we decided, again, for our departments to come together in co-creation and collaboration and kind of role modeling how we can work across departments, even within organizations, to achieve this initiative. So the culture of innovation and quality model that we created was adapted based on the National Association of County and City Health Officials. It was a version that they disseminated in 2018, which was really a roadmap to a culture of quality. And we took that and we thought about it through, again, that synergistic lens of innovation and quality. So the concepts really represent how they're used, again, together. And then we designed the survey questionnaire to mirror this conceptual model. So the survey itself highlighted the 6 key domains that you see here, including staff empowerment, teamwork and collaboration, leadership, customer focus, infrastructure, and continuous improvement. So you're going to be seeing these domains throughout the presentation. But if you can think about and reflect, how might cultures of innovation and quality thrive when we're really viewing the culture from a lens that incorporates all of these various domains? We understand that most environments are complex adaptive systems, and we need to apply multiple perspectives, and we want to imply and explore perspectives from the staff, from the customers, from the leaders, from how we utilize our skills and behaviors as teamwork and co-collaborators to create that infrastructure in our organizations, which leads to hopefully continued improvement. So hopefully you can see the threads through all of these as we feel this conceptual model really focuses on all of them, with the culture of innovation and quality as the centripetal force kind of driving all of these synergistic components together. So for our descriptive pre-post study on the culture of innovation and quality, we surveyed full and part-time employees at the American Nurses Enterprise. And the pre-survey, we received 131 responses, and we had a response rate of 40%. And we also received exempt determination from the IRB. And this survey instrument was developed and refined by our team and pilot tested by an internal group of volunteer employees from various departments. And I just want to pause here and talk about that for a second, because when I was thinking about this, opportunity to be together and have this great discussion this evening, I wanted to share some takeaways that really impacted me. And one of them was having the opportunity to, again, pilot test this survey. Because when we had an opportunity to come back and learn from the folks that initially took the survey, we received such robust feedback. It was questions about, hey, what does this word mean? I don't know if I understood this, or what is the flow of the survey, and how might we change it to provide more transparency around, the focus areas that we're trying to understand more deeply. And, when you tried to explain it in the beginning, you can probably pare that down because maybe it was too wordy. And so we just received all this great feedback, which really helped then, I think, and I think attributed to such the high response rate that we took the time to ensure that it made sense. When sometimes you're steeped in an area and you're living it day to day, it's nice to have folks, again, be able to inform and say, maybe this isn't my area that I'm focusing on all the time, and that's why this survey, it needs to make sense to everybody. So again, I just really go back to that pilot testing, and so glad and wanted to share that as a really important takeaway, that pilot testing piece is incredible for feedback. We did analysis with the pre-survey that included frequencies, quantitative analysis that included frequencies, chi-square and t-tests. And then for the survey, we also concluded with open-ended questions to collect feedback, and those qualitative responses underwent a thematic analysis to report key findings. So our objective was really to quantitatively summarize those pre-intervention baseline attitudes towards innovation and quality knowledge, engagement, and practices. And then with that, now we're at that intervention development and implementation. So I just wanted to share some of the initiatives that we're focusing on around our interventions. So around that domain of staff empowerment, we're including a hybrid SIP Learn and Grow session that's going to be open to all employees to share key survey findings, provide education on available resources, and really engage employees in discussions on how they're implementing innovation and quality in their work. And then talk about the challenges and barriers and share ideas really to further promote the culture across the organization. So that's one of our interventions that we are going to be undertaking. In the domain of teamwork and collaboration, our interventions are going to be related to that education on the benefits of working together and modeling how we were able to do this across departments with this focus on innovation and quality, and look for potential opportunities for other teams to partner and co-collaborate internally to really advance our strategic goals, improve efficiencies, and really foster curiosity. For that leadership domain, we've already presented to leadership, and we have other examples around the broader interventions that we're going to be doing related to innovation and quality, to really ensure that we have leadership buy-in and that they're aware and can understand the ways in which we're going to be rolling this out through the process of the entire study. For customer focus, we're going to include education about how quality management contributes to customer satisfaction, and really sharing, again, those tools and resources for implementing quality-based decisions that really collect customer feedback. We're going to be tracking trends and considering requirements that really aid to the process of continual improvement. For infrastructure, we're going to focus on, again, increased education and communication, opportunities to provide additional resources. One of the feedbacks that we got in the qualitative summary was that often some of our educational initiatives roll out during meal times. And so that's why for our SIP Learn and Grow sessions, we're having them in the afternoon so that we're not interfering with people's lunch and protected time. And then for continuous improvement, we're going to look at strategies and look at tools for documenting work processes and adopting those lessons learned, right? What have we done that we know is working, and what do we want to elevate to ensure people have more resources and more ability to gauge in those opportunities for professional development? And then after we do all these interventions, we're going to conduct our post-intervention survey and measure the employee attitudes, again, towards innovation, quality, and engagement practices. And then continue to identify opportunities that will adapt and adopt continuously. As we know, with iteration and innovation and quality, iteration is key. And so having that flexibility to continually adapt is something that we're very excited to ensure has a front and centered approach in our interventions. So as part of our study for our dissemination strategy, we created an infographic. So I just wanted to show you some snippets from our infographic and share some of our survey results from that pre-survey. So the survey highlighted those 6 key domains that we talked about earlier to really foster that culture of innovation and quality. So employees really reported strong results across all areas, with customer focus rated as the highest, which you can kind of see from that spider diagram. We had customer focus as the highest area, and then we had infrastructure identified as our greatest opportunity for growth. And while closely aligned, we found that quality consistently outperformed innovation, and respondents from departments that routinely engage with those ISO standards, the ISO 9001 2015 quality management standards, had statistically significant higher perceptions ratings of quality when compared to other areas of the organization. So we thought that was an interesting finding. Another aspect of our infographic, in-house experts, employees rated knowledge a 9 out of 10 staff felt they had some or a lot of knowledge of quality at 92%, and innovation at 91%, really affirming their capacity to drive positive change and continuous improvement both within and outside of the organization. From a learning mindset perspective, the respondents from the survey stated that they deliver the best for nurses by applying what they have learned, from innovation at 79% and at quality 88%, with the activities to advance their work. And then finally, when we're thinking about customer-centric, our respondents felt they considered the needs and values of the customer 90% when engaging in activities related to innovation, and 97% when engaging in activities related to quality. So when we looked at that spider chart earlier with that customer-centric approach, you know, this is something that we thought was really impactful. 97% of respondents felt they engaged in activities related to quality when thinking about the customer. And 90% of respondents felt they engaged in activities related to innovation. And I'm just saying this statistic over again because, again, when we're thinking of that thriving culture of innovation and quality, there's an aspect where employees have to feel that meaningful connection of why they're doing the work, and with the customers that they're engaging with, and able to tie that thread to the work that they're doing directly related to the customers. That's something that we've had a lot of conversation and continued attention around that finding. So opportunities for growth, right? Every time we get feedback, there's always opportunities for growth, which included leadership buy-ins. So some of the qualitative results included suggestions to ensure that leadership supports for employees to feel empowered to participate in both innovation and quality activities. We know, I feel like all of us probably feel that fast-paced and complex work environment really requires an organizational culture that embraces new ideas, which can be supported through dedicated research, another opportunity for us to improve. And a thriving culture of innovation and quality really deserves the curation of resources to really nurture new ideas and assist people in responding to those complex challenges. And then finally, to promote continuous improvement, implementing innovation and quality practices into performance goals is something that we're exploring, because that may assist in the further development of processes and systems and the ability to meet quality standards and customer expectations, in the advancement of organizational standards and excellence. I'll be happy now to turn it back to my colleague, Tanya.
Great. Well, thank you so much, Olivia. So as you can see from her excitement, our whole team is very excited about the journey and conducting this study in our organization as we, it is a journey in terms of promoting a cultural transformation to really embed innovation and quality into everything that we do in our daily work. And something that's really important to be able to be successful in that, in creating any type of culture change, is to have a safe work environment and to be able to empower our employees to be able to innovate and make decisions and feel like they're making a difference with their work within the organization. So I would also be curious, I know if you would like to put in the chat, a lot of organizations conduct many surveys and assessments of their employees. So if you have conducted any surveys or types of assessments of your employees related to quality and innovation, I would be interested if you would share that in the chat, or if you have kind of what type of activities you may have done to get a better understanding of the level of innovation and quality in your workplace. So something that Olivia did mention is related to being successful in fostering innovation and quality cultures, and some of the feedback that we did receive in our survey, and as we all know, is that importance of leadership and having that alignment with the organizational strategy. And you can see here on the left, we have shared the vision, mission, and values for our organization. And I feel like we are frequently focusing on this when we're collaborating with others in meetings. We often will hold meetings and we start out with a values story. And so really trying to demonstrate the importance of these values and that it really does matter for our organization and it matters to our employees. And we do see that it may take some time if that's something that you're not already doing in your organization, but sharing those stories are so important because people might not realize that these values are really being embraced within the organization. And it also can provide a way to provide recognition for others. So oftentimes when we have people sharing these values stories, they're talking about their colleagues and their coworkers that they've worked with on projects and recognizing them for their great work. And I think to be really innovative, it requires collaboration and working together and sharing ideas. So incorporating innovation and quality into these stories is one way that it could be really successful. In terms of the leadership, education and support is necessary. So not just support from leadership, but education, right? Does leadership in your organization understand what is quality? How do I promote quality? What are the key things that I should be doing or we should be doing and encouraging our teams to do to promote quality and innovation? Ongoing communication, you probably already know this, but I just can't stress enough. And we've heard in feedback from employee surveys how important communication is, and repeated communication through various channels, ensuring, especially if you have a larger organization, ensuring that information is trickling down to all of the employees and they're getting those messages. Having those professional development opportunities and education opportunities and repeated and ongoing opportunities, because we're continually having staff turnover, or maybe it's been quite some time since people have had that opportunity to participate in education. So that's really an ongoing career development, professional development opportunities that we need to be offering. In building that employee engagement, as I mentioned, by sharing those success stories, having champions that can help to promote, and ensuring that management is supporting and promoting as well. So it's really that leadership component is important to really have that employee engagement be effective in organizations. So I'm going to pause here for a moment just to look to see what, there was a few things that were posted in the chat. Oh, so these are the questions I see that are posted in the chat. So I'll just read those questions. If you didn't take a look, one question, if you have conducted surveys of your leadership or the workplace about quality or innovation, please let us know. Also, how else do you measure maturation progress for quality and innovation within your organizations? And what other things are you doing to promote quality, innovation, or innovation management? Do you have a change or continuous improvement or lean project focused on these types of areas? And I do see one person has posted their organization offers LSS Yellow Belt training. Wonderful, great to see. And then also several innovation management projects that occur regularly. Thank you for sharing, and we encourage you to keep sharing strategies and things that your organizations are doing, maybe that we haven't shared in our presentation here today. So in terms of the education piece, and one of the things that we did learn in our survey results is that there was, people weren't quite as familiar with the existing resources that we made, at least that I thought that they would have been. And so we found that was a great area for opportunity, and that we need to ramp up our promotion of these resources. So in addition to hosting learning sessions, just posting on our organization's intranet site, sharing in the newsletter, including it in the footer of our emails and when we're communicating with people, making sure we have just having any opportunities to, hey, have you heard about these resources? Are you aware of these resources when we're interacting with others in the organization? And maybe if you have, all staff meetings or leadership meetings or other types of team meetings, to have opportunities to share these resources. One thing that our organization often does is put time on the agenda for meeting agendas, regular one-on-one meetings or team meetings where you can talk about, so what are some examples of innovation that have been done, or what are some quality activities or opportunities for improvement that you see, and how can we brainstorm and collaborate to come up with solutions or new ideas of new ways to doing things. So I'll say again, promotion matters, communication matters, and I don't think that you can really over communicate. I do a lot of survey research, and I don't think I've ever heard anybody give me the feedback that you're over communicating. So please make sure you are promoting the resources that you already have and that those are being used. So our journey as co-collaborators here, the innovation team and the quality team at the American Nurses Enterprise, has really focused on this exploration and amplification of innovation and quality synergies that can be used to foster a thriving organizational culture. And we're hoping that our findings here can provide a blueprint for other organizations seeking to advance innovation and quality knowledge in their organization, as well as engagement and practices to assist employees in providing better services to colleagues, partners, and customers. and that we can measure these results and hope to see positive outcomes based on implementing these new strategies and building this culture of innovation and quality. And so now I think I'm going to turn it over to Oriana.
Yeah, hey everybody, good afternoon. Thanks, Tanya, for tossing the ball over. So everyone, very nice to be here with all of you. We so kind of honor the time that you're taking to be a part of this conversation this evening. And I don't know about you, but I think it can feel very hard to recognize history when you're living through it. And I think that all of us right now are in the midst of history in the making. And so when we think about innovation, when we think about quality, working at the American Nurses Association and for the enterprise, I can tell you that nurses, wherever they are working and innovating, across the healthcare ecosystem, these aspects of what we're describing as a part of this work, it impacts nurses and through them, the organizations that they work at, and for the people that they care for. And when we think about what's happening right now as it relates to technology, technology is completely reshaping these foundational aspects of healthcare. And that is looking like the reimagining of what hospitals need to look like and the kind of care that's going to be delivered there, care delivery itself and where it's delivered, and also this aspect of invisible care moving forward. And when you think about, I'm not sure if any of you saw the Center for Medicare and Medicaid Services drop their new technology ecosystem with over 60 industry partners just this month. And again, as we're looking at this massive restructuring of our healthcare system, it's definitely leaning into technology. It's leaning into what is the role of artificial intelligence moving forward. I'd be curious to know how artificial intelligence is impacting all of you. And I think about, for all of us in this room, right, at some point in our future, imagine having somebody ask you the question, what was life like before artificial intelligence? And so when we're thinking about, right, what's happening, digital health is the future unfolding in real time right now. And digital health and healthcare, and the reason why we're tracking all of these different trends in the innovation space is because we have nurses working in all of these spaces, that we as an association, we represent those nurses. It is our job. We are the professional association for registered nurses. Simultaneous to that, we have a philanthropic arm. And then we also have the American Nurses Credentialing Center, which also represents individuals and organizations. It's where our research team lives. And in the innovation space, our job and our role and department crosses all three of those entities. So when we think about all of the different ways all of these changes are impacting individuals who work in healthcare, the organizations that provide that care. Again, it's our job to stay on top of these changes in the innovation space. So innovation right now and kind of this emerging technology looks like telehealth that is really being adopted to drive new revenue stream diversification for organizations. Really this aspect of consumer healthcare disruption is really shifting that relationship between kind of traditional care that was provided and new models of care. We're seeing new models that are present around data integration, and there are lots of challenges and opportunities there. Like we talked about artificial intelligence. How is artificial intelligence going to be utilized to help remove some of that administrative waste and simultaneously help with cost reduction? And then looking at health data interoperability and the opportunities here for that is, for existing healthcare systems, right? Established organizations really used to compete on reputation, on scale and location, but all of these new entrants into the healthcare space, they're leveraging edge computing, advanced APIs, seamless integration layers, and really rewriting the rules of care delivery itself. And so in the shifting competitive landscape, it is really evident that even some of our existing models around primary care and chronic disease are being tackled head on by our big tech partners. And we're seeing cloud native architecture, intelligent automation, the explosion of the Internet of Things in our medical devices. What this looks like in rural healthcare, we're starting to see our rural healthcare facilities really becoming these hybrid care hubs. We're seeing the expansion of 5G networks, and with that 5G, knowing that we're heading towards 10G networks moving forward. Best Buy Health is deploying smart home technology and ambient sensors so that people can age in place. Walmart retail clinics really using that Internet of Things and diagnostics and cloud-based electronic health records. And with that, it is real-time analytics. It's predictive modeling that is really in real time starting to revolutionize not only care delivery, but also how we're looking at value-based care. We're also seeing tech stacks around treatment modalities using augmented reality, virtual reality therapeutics, virtual reality for mental health treatments. Applied VR just received FDA clearance for pain management platforms using immersive therapeutics. And then we're also seeing this quantum computing. Earlier this year, right, we saw the first release of the first quantum chip, which would fit in the palm of your hand. So now starting to blend quantum computing with molecular modeling and 3D bioprinting, smart materials. Artificial intelligence and this technology is truly allowing us, as we talked about personalized medicine and healthcare for a long time, this technology, these systems are actually getting us to the point where care can be personalized. And you layer that with biotech, again, we're seeing personalized solutions for people and the disease processes that they're managing and also their health. So when we're looking at new technologies and how this enables better care, it is new care models, it's expense reduction, it is broader geographical footprints. You can reach a lot more people digitally than in a brick and mortar facility. We're seeing, again, data, and is your data clean enough to be able to be utilized by artificial intelligence? But simultaneously, right, it's there's this aspect of all of this information, especially around genomics and precision medicine, where we have biosecurity risks and breaches that are happening. So this whole aspect of cybersecurity around our health systems, we're seeing disrupted revenue models, those new entrants or competitors, and then also healthcare systems that are operating on capital-based systems for IT infrastructure that are seeing this this IT capex that it's hard to keep up with all of this technology that is being released and as quickly as it's being released. So and the costs that are then associated with it, because to make a change in healthcare is to maybe make it across multiple facilities with hundreds, if not thousands or tens of thousands of employees, depending on the size of your system. And so one of the things as we're thinking about kind of this aspect of healthcare and the return on investment, it is really for existing healthcare systems. It is not a total overhaul, but it is really about transformation in this system. And how do we get to this future state? And as a professional association, as our mission. Tanya shared our mission earlier, which is a healthier world through the power of nursing. How do we support nurses to bring their ideas forward, and their innovations, and their creativity to solve some of these incredibly complex healthcare issues, because that will improve care for both you and us. And we need to make sure that our employees are supported to provide high quality work and to innovate, because our employees support all of those nurses. And there are 5 million nurses across the United States. And we want every single nurse in our country to be able to see themselves as innovators who can actually help improve the systems that we're all navigating. And so this moment really requires that we evolve or risk irrelevance. And so more thinking about this, where innovation and this quality model come together, right? We can move forward quickly and ensure that we bring people with us while producing high quality work. And if any of you are kind of future thinkers, I highly recommend checking out Buckminster Fuller, because he called for us to be the architects of the future and not its victims. And so how do we step into this space of all of this emerging technology, this history that is unfolding around us in real time that we are a part of? This is going to be a part of our story. It's going to be a part of the story of our organizations. And so we really want to support people to be able to lead in the best work that they can, and feel supported to do it. So thank you so much.
Thanks,
Well,
Olivia.
thank-
I was going to post the last question in the chat that we wanted to share here. So I'll go ahead and pop that in. With all that discussion about technology, so have you participated in the implementation of emerging technologies, and are these enhancing or creating barriers to your daily work? So if you have experiences of that, please go ahead and share.
And we did have a response to an earlier one where you all ask about kind of their rollout across organizations. And we have Sharika saying her organization's HR department implements quarterly quality checks, and they really bolster that maturation through making them part of the employees' performance-based metrics. So innovation and quality are definitely baked in and are at the forefront. So yes, maybe from a show of hands or a one in the chat, if you're working with some of these innovative technologies, especially as our panelists have stated, and maybe what's one quality or innovation challenge you're having with the integration of this newer tech stack. Well, I think you nailed it, right? I mean, you really talked about the entire spectrum of what we are seeing across the enterprise, not only in our healthcare arena, but in pretty much every industry. So I loved how you pulled the thread on not only the challenges operationally, but from an enterprise standpoint, simply trying to get ahead of the rapid innovation and change that's occurring, not only in the tech stack, but with the breadth and depth that AI can bring to them. So maybe we'll I don't see people answering this, so why don't we turn the question back to you all? Maybe what are you foreseeing as the greatest opportunity with these technologies, and then vice versa, maybe the biggest challenges that you see a lot of your constituents facing?
I would love to just kind of loop back. Amy Lynn put a comment in the chat around really the new technologies are good, but often our industry moves doesn't always move fast enough for the time allotted for development, training, and assimilation. And I think that is a really important aspect because we spend a lot of money on, buying these, putting these new technologies into place. And that is not it's not just the cost of the technology, but to Amy's point, it is really about the training, orientation, and familiarity of the staff who are working with that technology every single day. And if they don't feel comfortable with it, or they were not included in the design or the creation or how that technology or system is going to be utilized, that was a massive investment for a piece of technology, a device, or maybe software that is not going to be utilized. And so I think Amy, to your point, I think you nailed that on the head. It's okay. Your typo is just fine. I think I picked up what you were saying. You're all good.
Well, and I love it, right? Because it just goes back to the power of change, right? And our roots in lean enterprise and our roots in continuous improvement and our roots in change management, right? And really helping not only to drive awareness, engagement, and knowledge and skills, but then anchoring that in so it's sustainable going forward.
Yeah.
So yes. Okay, so folks, do you have more? Are we wrapping up?
I mean, I'll just add one comment. One thing that I learned through this collaboration is that innovation, a lot of times when people think about innovation, they think it has to be this huge, high level thing, or that it's related to technology, and it doesn't have to be. So I think it's important to have a common understanding of what is innovative. It could be a small idea that made a big difference in terms of, changing a process or making something more efficient or effective. And so I think that's something that I learned because I probably had a different perception of what innovation was until we had this partnership and had a lot of discussions around it. And I think that's important to share that with your employees. So if you're trying to promote that at your organization, it doesn't need to be something really huge. It can be something very small, and that can have a big impact.
Thank you. Yes, and I love what you're doing with regard to, you shared the innovation management principles, and that really hones in on the breadth and depth and scope of innovation opportunities, right? I mean, there's a governance piece, there's a process piece, there's definitely a people piece, and there's a technology. And then there's, looking at it internally as well as externally and some of the constraints and or enablers that are going on. So thank you all so very much. So let's give a big round of applause to our phenomenal facilitator, Dr. Campoli, and our panelists, Dr. Today, Dr. Lemberger, and then Miss Mulvey. We are so very grateful for all of your wisdom and guidance and sharing with us really a deep view into this healthcare and education arena, something new and novel to our innovation management team. And we're so grateful for the partnership with our healthcare division team and each and every one of you.
Thanks for having us.
Thanks so much.
And I love how you just foot stomped everything that we talk about. It was just absolutely perfect. So again, ladies, just a tremendous job. Thank you so much for the breadth and depth and scope and really this engaging look at innovation management and quality and excellence within your industry segment. So as we close today for our ASQ Innovation Division and Healthcare Division discussion, we want to share with you our innovation officers. Here's a shout out to our chair, Mr. Tracy Owens, our chair-elect, Miss Jackie Jolly, our secretary, Miss Sonia Montero, and our immediate past chair, Miss Rebecca Mott, and our financial manager, Mr. Larry Miller. We cannot do all the great things that the division, especially these collaboration activities with healthcare division as well as others, without the phenomenal leadership of this team. So if you are interested in joining the team for 2025 or moving forward, you can reach out to Tracy at towens@memberleader.asq.org, and we'll send you this deck as well as our speaker, our phenomenal guests tonight deck, and you can hit the link on the volunteer survey if you would like to share your expertise with us. Last but not least, we invite you to visit our innovation division My ASQ space, where you'll find resources and discussions specifically on topics of interest across innovation management. If you've not had a chance to review the ASQE Insights on Excellence, it's a phenomenal set of research reports that they publish from around the globe. Innovation plays a big part in examination of what challenges and enablers our commercial constituents are facing across the globe. So we invite you to review those as well. It covers many industries as well as our phenomenal healthcare industry represented tonight. And then if you're not a member of ASQ or ASQE, we invite you to press the join link and find out more about our phenomenal organization. And last but not least, we invite you to our upcoming series of discussions for our late summer into fall and early winter, where we discuss innovation and emerging technologies, igniting the future of quality, how Quincy is redefining excellence with AI at ASQ, navigating leadership, fostering continuous improvement and total quality management to drive operational excellence. And then we round out our series with embedding a culture of continuous improvement that sticks. So again, ladies, thank you so much for the breadth, depth, and scope of your discussion. I think we covered pretty much everything, and you gave us a look behind the curtain, so to speak, on all of the great work that you all are doing within quality, innovation management, innovation, and excellence. So again, this is Dr. Rhonda Farrell signing off for the ASQ Innovation Division and Healthcare Division with, again, a big thank you to our phenomenal facilitators and presenters tonight. Good night, everyone. Have a safe weekend, and may you innovate accordingly.